here at Sonoran Living, you know what? We care about your heart. We want to help you keep it ticking as long as possible. And as always, on the 15th of the month, we, along with Mayo Clinic, remind you of our Rally for Red campaign. So joining us today, one of our favorite doctors, Mayo Clinic cardiologist, Dr. Todd Hurst, is joining us this morning. It's so good to see you.
Great to be here. Thank
I'm
you.
excited because you know what? We're talking about AFib. And here's the thing. It's arterial fibrillation. Most of us know it as AFib, but you know what? It's sadly becoming an all too common experience for so many people. And you said, but yet 80% of Americans don't even know they have it.
Yeah, that's right. You know, atrial fibrillation is the most common heart rhythm problem out there. The recent data suggests 1 in 4 older adults are going to have it, but the experts tell us those numbers are going to double in the next 10 years or so.
What exactly is it, Dr. Hurst?
So atrial fibrillation is a heart rhythm problem where the top chambers of the heart, rather than contracting in a coordinated fashion, which is normal, they just quiver. And the problem is that blood can get stagnant in the crevices of the heart and form blood clots, which can break off and cause stroke and other problems.
And I don't know if you guys at home know this already, and I said, what is the difference between a stroke and a heart attack?
Yeah, so a stroke is when the brain is not getting blood flow and brain cells die. A heart attack is when the heart muscle is not getting blood flow and heart muscle cells die.
So AFib won't cause a heart attack?
Well, it could. If a blood clot went to the heart, then it could cause a heart attack also there. But usually the concern with atrial fibrillation is more about stroke.
And of course, in some of these other unfortunate ailments, which would be dementia, ultimately it could cause death?
Yeah, so people with atrial fibrillation are at very high risk of stroke potentially, but we know they're also at high risk for dementia, heart failure, and even early death.
Is it genetic, or is there another reason why people get AFib?
Yeah, atrial fibrillation is really complex, but the big drivers of atrial fibrillation for the epidemic we have is primarily older age and then the lifestyle-related diseases like obesity, high blood pressure, sleep apnea.
So when somebody comes to you and by the time they're not feeling well, that's not a good thing, but when somebody comes to you and you diagnose them, what are the treatments if they didn't even know they had it? How do you help them?
Yeah, so atrial fibrillation, again, is complex, but for those who have AFib that comes and goes, we call that paroxysmal atrial fibrillation. We have a lot of treatments for them. They can be drugs, ablations, electrical shock. The problem is none of those work really well. But what recent data is suggesting that there is a treatment that we're excited about, that we can bring hope to some of our patients that have atrial fibrillation, and that's the effectiveness of modest weight loss and improving physical activity.
Okay, matter of fact, here's a good list right here of just some of the things you can do if you already are diagnosed with it. Is it should I use the word reversible? Can you stop it in its tracks if you change your lifestyle?
Yeah, it can. Again, it depends on the specifics of it. Some atrial fibrillation is chronic and there's little that we can do about it. Some of it comes and goes. Turns out that there is some options for us to help prevent it from recurring in people.
And if somebody comes in to see you and they didn't know they had it, what's the telltale sign to you as the physician that says, this could be a problem?
Well, usually about 80% of people don't know they have atrial fibrillation. They don't necessarily have symptoms, but what is noticed is their heart rate is fast and irregular. Those are common things that are noticed.
Wow. All right. Well, gosh, I already learned a lot here this morning because, you know, we hear the term a lot, and I just honestly didn't really know what it meant. So thank you very much, Dr. Hurst.
Always a pleasure.
Always appreciate you here. And guess what? We want to keep you heart healthy, and we do that every single month right here at Sonoran Living on the 15th. For more information about heart disease or to schedule an appointment with a Mayo Clinic cardiologist, you can call 480-301-8200. And of course, you can always learn more at mayoclinic.org. And don't forget, ABC 15 is teaming up with Mayo Clinic for our Rally for Red campaign. Each and every month we'll give you easy to follow recipes and ideas to help keep you and your loved ones' heart healthy. To learn more, get our Rally for Red reminders. Sign up at abc15.com/rallyforred.